What are the symptoms that may indicate heart complications? So, a lot of patients who do have heart complications have chest pain, palpitations, shortness of breath, and findings on EKGs. How do you diagnose cardiac issues related to COVID? So, when patients, let's say, get admitted to the hospital, they would have a lot of times elevated troponins, BNP, which indicate heart failure. It's a cardiac enzyme marker that's elevated in patients with heart attacks. They have EKG findings that are suggestive of sometimes myocarditis or MI, and echocardiogram could be done to see if they have issues with heart failure. Are there effective treatment options? It depends on what patients have, but yes, there are effective treatments when patients have new onset AFib. The cardiologists are involved. They control the heart rate and make sure that they're on blood thinners for the AFib. I mean, it depends. As I said, if you have a heart attack, they will be involved and most likely undergo cardiac cath and stent placement and so forth. When should a person see a specialist and what type of specialist should they consult? So, if you have any signs of even a minor cardiac issues, cardiologist should be consulted right away. The main thing that I tell patients if they're in the office setting is to make sure that they are seeing a cardiologist regularly to make sure that their situation is under control and they're being treated appropriately. Because sometimes when you have mild cardiac issues, sometimes patients are non-compliant and they may not be following up with a cardiologist if they don't need to. So I always emphasize you need to see the doctor. If they're at risk, I make sure that they stop smoking. We always talk about smoking cessation. We talk about low salt diet if you have heart failure. So yeah, I do try to put my input into their cardiac health, but at the end of the day, they really need to make sure that they are compliant with seeing the cardiologist.